Um, Thank you all so much. If you happen to hear my puppy chewing, he's eating lunch, so I apologize. um, but Sarah, thank you so much for having me. I'm ecstatic to share some of the information and things I am got going on in the community here. And so specifically sharing about something very dear and near to my heart, which I started here a couple years ago. And it's an organization, community-based organization, Melanated Midwives. It's a non-for-profit organization, and my goal is to support the next generation of midwives and pregnant people of color. So with that, let me just move this out of the way here. So I am a certified nurse midwife. I graduated from UIC in 2017. I went through the what was the GAP program at that time. It's no longer called that. So I'm an alumni of that program, where we started off obtaining our nursing diploma and then went straight into the specialty that we selected. So I graduated from that program in 2017. From that, I have been busy ever since. I currently am an adjunct clinical instructor at UIC in the Department of Human Development and Nursing Science with some of my colleagues on here. I'm also the Director of Midwifery Services at the University of Chicago in the Department of Biological Sciences. And then I'm also the founder and CEO of Melanated Midwives, which is a organization I founded in 2019. In my spare time, in addition to that, I am also the interim president of the ACNM of Illinois Affiliate Chapter. And then I have been, dabbled a little bit as a nurse before I took my journey as a midwife. So born and raised in Chicago, been here all my life, and have raised my child here and my family's here. So the South Side of Chicago specifically is definitely dear and near to my heart. So Melanated Midwives, I founded it in 2019. It is a 501c3. My vision stemmed from being a single mom of color, just trying to find my way in the career that I wanted. I always thought I wanted to be an obstetrician, but life didn't allow that. They have crazy hours and residency and all of that. And so that didn't allow for that opportunity, but I found about midwifery and I was ecstatic. And so just being able to go through the program and having some, financial struggles and managing life as it often happens. My mission when I told myself when I graduate and I get out and get my feet wet, I want to be able to support those who are coming from behind. And so I created this organization, Melanated Midwives, and I want to support the next generation of midwives of color, specifically diversifying the field of midwifery. And specifically, as I grow Melanated Midwives, a lot of things that you're dabbling in and our mission and vision tends to increase. So with that, we are specifically trying to provide care to the most vulnerable populations, assisting in decreasing the infant mortality rate in Chicago. And that's through our efforts with community-based research and education to our pregnant patients. So just to touch on here a bit more specifically, the mission is to, like I stated, diversify the midwifery profession and empower Black birthing parents with resources and tools to successfully really navigate their prenatal and postpartum care. The vision, actively engaged in addressing the deserts that have been created by not only the closing of various labor and delivery units, but the closing of several hospitals on the South Side of Chicago, and really figuring out how we can collaborate with other individuals in the community, such as not only just the patients and the mothers, but politicians and other community-based organizations to really collaboratively think how we can really address this. And then the insight is just, unique and highly valued experience, expertise, collaboration is important, and there's no one entity, one institution, one individual who can really solve this problem. And so we are really focused on working with lots of people who can help us get this change happening. So as far as more specifically what I do, I provide $5,000 scholarships to students of color who are in midwifery programs, actively in their midwifery programs. And these are just some of the recipients that I have awarded some of the funds to. So the first year we had 2 students, and then this most recent year here, we had 7. And then this next cycle, we will have 10 that we will provide the $5,000 scholarships to. So with that, we've had lots of support, not only just in the community, but also nationally. And we also received a lot of research funding here recently, as well as some local support as well. And so we have recurring annually Blue Cross Blue Shield community-based grant that we received. This is our 2nd year now, and $80,000, and that specifically supports the students' $5,000 grants. And what we have done also is we can't fund everybody with the $5,000. So what we decided to do was, if a student did not get an application accepted for the grant or for the scholarship funding, then we would support them in their board certification exam, which can be anywhere from $500 to $1,000. So we've been providing about $500 as funds are available to help them with that cost. Our community-based other organizations and individual funders have been very supportive and generous there with probably approximately $20,000 worth of funding. And then we just recently, as a community-based organization, in collaboration with myself at UIC and my other co-investigators at UIC, received a $7 million grant from POORI to really look at some of the things that we wanted to change specifically, and I'm going to go into that here in a few. So what is the problem? Okay, you know, the impact that is had on our maternal system, is specifically on our Black maternal health. Maternity care is failing Black women. It just is. Black mothers experience disrespectful, discriminatory healthcare every single day at very alarming high rates. Insufficient coordination with mental services, home life services, financial services, you know, other additional wraparound services. And so we need to address that. 1/3 of all maternal deaths occur within the first year postpartum. And most interventions target individual level projects or solutions to the problem. And then, as we know, postpartum care is often, often neglected and leave them kind of hanging, because traditionally that care, after having a baby, they have about 6 weeks until they're, have additional communication or services or help with their healthcare system. And so that's just too long. 83% of maternal deaths in Illinois are preventable. For each woman who dies of maternal causes, as many as 50 to 100 more experience life-threatening complications, what we often call those near misses. And this impacts Black women disproportionately. So what needs to happen? We're in need of a maternity care paradigm shift. Discrimination in healthcare reinforces the feelings of mistrust and lack of engagement among Black mothers. These systems fail to expose the social mechanics that are driving the disparities in maternal morbidity and mortality. There is no single intervention, that has really addressed this problem head on. And then the complexity of what we are experiencing, what our patients are experiencing, it needs a multifaceted approach. So a model of maternity care that centers on Black women is needed, as well as inclusivity of broad structural changes to truly attenuate the impacts of structural racism. And so this is where we come in. So POORI funded us, and I say us, my team, my wonderful team, Dr. Geller, Dr. Patel, Dr. Lees, Dr. Pearson, and Dr. Lofton. We submitted an application to POORI with a model of care that we felt would encompass evidence-based research practices collectively will address some of the issues that our moms are experiencing, and eventually will be scalable to other institutions to help with their issues as well. So POORI, which is a patient-centered outcome research institute, it's a non-profit, non-governmental organization in Washington, D.C. that was authorized by Congress in 2010. And their goal is to improve the quality and relevance of evidence available to help patients and caregivers and clinicians, policymakers make better informed decisions. And so they fund research specifically for to address these. So we submitted an application, we received funding, and our project, which is Black Midwives for Black Women, maternity care to improve trust and attenuate structural racism. Why do Black women need Black midwives? Partly because Black women are 3 to 4 times likely to die from pregnancy and birth complications that are preventable. Midwifery care is linked to lower rates of medical intervention and lower costs and better birth outcomes. Specifically, Black patients feel seen, heard, respected, safe, involved in their care when their provider looks like them, if they can identify with their provider in that way. That is evidence-based, as well as midwifery care is evidence-based. And so we wanted to make sure we were utilizing things that support the evidence and put it all together. So what was born of this was melanated group midwifery care. And the goal of melanated midwifery group care is to examine whether MGMC, a culturally adapted patient-centered care model, attenuates the impact structural racism on Black pregnant and postpartum women by assessing whether their increased health system trust leads to enhanced patient engagement. So there's specifically 4 factors of this model that we included to address the problem as a whole. And so again, the racial concordant care is what that is the correct term for having a Black provider for Black patients, or an Asian provider for an Asian patient. It's racial concordant care. Group prenatal care, which is also evidence-based in that prenatal care is provided in a group setting with several Black patients. And they're around the same gestational age. And so they will go through this group care together. And then we have case management, which is also evidence-based to help with connecting patients with referrals and wraparound services. And then finally, utilizing community-based doulas who have a connection with the patients in the community, and specifically using them with the patients during the postpartum period from right after they have baby until up to 1 year. And specifically because they have that connection, they're familiar with the person, they have a bond with the person, and more likely to share some of the issues or concerns that they're having during that postpartum period. So specifics about the grant and melanated group prenatal, melanated group midwifery care. We're hoping to enroll about 432 Black pregnant patients in their first trimester. Half will receive traditional one-on-one prenatal care, seeing their provider, as we know prenatal care to be. The other half will have this melanated group midwifery care with about 8 to 10 patients, and have several interactions spread out over their prenatal care, which ends up about being 10 to 12 sessions. The sessions will address pregnancy and birth and postpartum, as well as motherhood. In addition to that, the nurse care coordinator, which will be a part of that care coordination services, will coordinate sessions, form relationships with the patients, coordinate referrals for such as housing or social services or mental health, or if there's a health-related referral, so if they need to see the cardiologist and need to get an echo, or if they need to speak with the pulmonologist for exacerbated asthma, they will make sure that those services are obtained and then scheduled. And then, which is a key component of this project, is our postpartum doulas, who are community-based, already practicing in the community, seeing patients at this time. And so we have brought them on into this project with the hopes that they will not only continue to, help with, labor support, but also do home visits and assist with baby. So, as we know, when you get home and there's other tasks that need to be done if you're managing baby. And so they will truly be able to assist with that, so that the patients aren't lost to care in those 6 months, in those first initial 6 weeks, but also that they aren't lost to care further along. We all know that in that first year, most of those situations occur. And so we're not dropping that service just at that 6 weeks. We're extending it all the way to a year. The goal, or the vision, I should say, is to, if something arises, the doula will be assessing or in contact with the patient. And at that point, anything of concern will be brought to the nurse care coordinator by the doula. And then from there, if it needs to come back to the midwife, then the care coordinator will bring it to the attention of the midwife. If it's a healthcare concern or something the nurse care coordinator cannot address. And again, to highlight, this will happen over the course of that year of postpartum. So just a visual of what the activities will be, the outcomes, and just what we're hoping to see through that. So we have our racial concordance and the continuation of care, which is patient-centered. We have our evidence-based model of the group prenatal care, hoping to disrupt those power hierarchies, allow for interactive learning, community-based building, and peer support. We also have the care coordination. So making sure that we're addressing unmet needs and assessments, making sure patients are having referral services, linkage to those things, and then providing the community doula to help recognize some of those things that may not be recognized by the healthcare provider in the time that they're not in our care. And so bringing that back full circle to the midwife to make sure we're in communication, but we're also just making sure our patients having a holistic wraparound service for their care. And so we are hopeful that this collective approach to addressing maternity care, postpartum care, will have a big effect on the numbers that we're seeing here, not only in Chicago, but worldwide, but also highlighting the importance of having a collaborative team of researchers, but also involving the community. The community desires to be involved in their care, but it hasn't been approached and designed in a way that patients feel comfortable and are willing to engage. And so we are hopeful that the parameters that we have put in place, the criteria we're putting in place, will be successful in changing those numbers. Any questions?
I have some questions.
Sure.
Thank you for the presentation. I did some research on Black maternal mortality for this like competition, but I didn't get or it wasn't accepted for the competition. Anyways, and like reading and learning so much about you know, systemic racism in our every semester, it's been like really enlightening.
Yes.
But I have a question about like, so in terms of the program, like logistically, do you provide transportations to the patients? Because then, you know, like what if they live a bit far, you know, you want to make sure that if there is an emergency that they are able to, you know, go to a hospital immediately. And then is there like a lot of like patient education in terms of like, do they understand the morbidity or the mortality that can, you know, that can happen?
Right. So to address your first question, yes, we're addressing transportation as far as patients not being able to get to appointments or get to the hospital, and making sure that some insurances that the patients have, if it's arranged, they can get care covered, they can get transportation covered by their insurance. So we are exploring that to make sure that resource is utilized. We also have contracts with services like Lyft. We have vouchers that we can utilize to get our patients to where they need to go. And then, of course, we have the use of our emergency services if they need to be. As far as your second inquiry, yes, we are educating our patients about their maternal health. And so the beauty of having the groups, we have an extensive amount of time to talk to them about what's happening to their body, what to expect, what does that mean, you know, what to look out for if you're feeling a certain way. And I've done group prenatal care, and it's well received by the patients. They feel much more supported. They also aren't feeling as if they're the only one who is experiencing this. Because of course, if you've had a child, sometimes you always feel like, is it just me? Like, who's having these issues? And it's not. And when you get together in a group, you're like, oh, they're having the same issue too. And they seem to be much more receptive to opening up about things that they're experiencing. And then that allows us to address those questions as a group, as opposed to traditional care doing it. Okay, I just talked to this patient about having, you know, contractions and what that feels like. And then 20 minutes later, I'm going to talk to another patient about contractions and labor and all that stuff. But we can do it as a group and everyone feels supported.
Yeah, that's a great idea, like the whole group thing, because that's really impactful for the peers, for the patients. But one more thing, I think, what about, is there like, do you help them with like the birth care plan, like in terms of like induction or like this, or like maybe having to do like elective, you know, surgery if it was like, oh, a nulliparous woman or like versus like a multiparous patient, you know, so it's like, do you suggest like, or do you kind of give them options in terms of labor?
Well, as far as option of delivery, we always want to aim for vaginal delivery.
Yeah.
The only thing that would probably risk them out is presentation of baby, which would be breech. And there were measures that were taken and that were unsuccessful. Then as far as coaching them through labor and support, yes, we're not changing our practice in how they want to labor. That will be the same. And so if they, however, we will go through their birth plan and their desires as a group, as opposed to individual. If we want to do, if they desire to do it individual, we can do that.
I think Angelique had a question. She has her hand raised.
Yes, Carrie, congratulations. This is outstanding. I mean, that's like bringing a baby to birth, you know, to be able to visualize it and then see it manifest. So congratulations to you. This is well thought of. I am definitely a proponent of group prenatal care, especially for our community, because I believe it will break down some of the division within our community. When I was growing up, the neighbor next door whooped me, gave me a whooping. So I just think that group prenatal care is going to bring some healing and some connection within our community. Are you using, so one of my questions were, is it the centering pregnancy model that you're using, or just, okay, all righty, I'll leave it there.
It's melanated group.
Huh?
It's melanated group midwifery care.
Oh, so your own, okay, all righty, awesome, congratulations. Okay, my second question was, I saw there were doulas, and I'm also an international board certified lactation consultant, so I'm a little biased when I ask this question. I know doulas can provide breastfeeding support,
Yes.
but let's just say your moms needed support beyond their scope of practice. Is your care coordinator, does she have resources for that? And
Absolutely.
in the lactation profession, we're also talking about people who look like us as well.
Yes.
So I was wondering about that.
So we're being very intentional on looking for individuals who can support our moms that are also supports our efforts of racial concordant care. And so we're trying to make sure that we have lactation consultants of color who can support them and make them feel comfortable about their breastfeeding experience.
Okay, great. And then my final question, I apologize if I missed it. Where is this project being implemented at?
So this will be implemented at the University of Chicago.
Okay. All right, thank you. Congratulations again.
You're welcome. Thank you.
Hi, Carrie. My name is Angel. I am a student at UIC, currently interested in going into midwifery, and I'm currently a birth doula. So I love this entire presentation. Thank you so much. I wanted to piggyback a little bit off of Miss Angelique's question and ask if that group midwifery care is also pulled into the postpartum. I know we talked about the doulas and the potential lactation consultants and resources, but is there also a group format to the postpartum care? I'm thinking about like group breastfeeding, or just group discussion coming in and having a check-in for 8, 12 weeks postpartum to keep that community of mothers and parents who are still, in a sense, going through having a new baby, right? Like on their own. So just wondering if that exists in the program as well.
And we're working in a couple sessions to do that. Not too many, but we have thought about that process and where that fits in. And so we're hopeful that we can do that. But we really wanted to focus on when mom and baby get home and having the postpartum care in the use of the doulas in that way.
Hi, Carrie. This is Eileen. Great presentation. I joined a couple of minutes late, and I'm curious about the care coordinators. Are the care coordinators nurses? Are they doulas? Are they community members? Who does the care coordination and decide where people need to be referred to?
So the care coordinators are registered nurses, and so they will be a part of the group prenatal care and making sure resources are allocated and connected with the moms, helping with our care, with the patients and their care, going through their prenatal care, making sure all of their labs have been completed and any other services that need to be addressed within the healthcare system is happening.
Great. Phenomenal project, by the way. Congratulations.
Thank you. Thank you.
Yuri, did you have another question?
Yes. So I think what I've noticed, hopefully the project has this issue to cover, is that when, after women give birth, then, because the midwives are not, they only specifically care for pregnancies and then labor. And then there's just this gap of women not being able to get care. The focus is mostly on peds. And so is that the focus of this of PIROC or PIROC, that there is going to be like a continuation of care for the mom or the woman.
Yes, correct.
Okay.
Because we're looking at that maternal mortality rate, which occurs during that postpartum period, that we want to stay involved in. And oftentimes you're right, the midwife can't be involved as much as we desire to be. But the nurse care coordinator and the doula will be our eyes and ears and bring that back to us.
Hi there.
Hi.
Thank you so much for sharing. I'm also in class with a couple of these people, including Angel, and I think we've talked about this before. I'm an expecting mother, and I noticed that you choose to use the language of melanated mothers, and as well as the diversity in those who you gave scholarships to. So I was wondering, I know the Black maternal mortality rate is what we're focused on, right? Like it is of epidemic proportions, but I was curious as to, are you recruiting on, must include Black mothers only? Are you choosing to use that more diverse language throughout your study or throughout your group? Because I aspire to be a midwife as well. I would love to become a part of this in, years to come. So I'm just curious on that aspect of diversity.
Everyone involved, from the midwife to the care coordinator, to the patient, to the doula, is melanated. And we are specific about that. We are intentional about that because that speaks to that racial concordant care, and it's evidence-based that it will make the difference that we're hoping it will make. Does that answer your question?
Yeah, thank you.
You're welcome.
Pam, did you have a question?
I did. Hi, Carrie. Thank you for a wonderful presentation. I saw your list of outcomes that you had on one of your slides, and I was wondering if you were also going to get input from those who participated in the program.
Yes. We're doing several surveys throughout at various milestones, and then we will have that at the end as well.
Thank you.
I had a question, if you don't mind, Carrie. I'm curious, when in the group that's receiving usual care, does that usual care, you had said that it's, kind of typical one-to-one, patient care. Does that include midwives at all, or is that specifically OBs?
It will be OBs and midwives.
Okay. Cool. There are some questions in the chat. It looks like a lot of your colleagues have answered some of them.
Okay.
Has a question in the chat that you don't think has been answered, feel free to raise your hand. I'm trying to follow them. And
Yes, please do. I had not saw the pop-up. Oh, I have this question here. What kind of training is provided for the community postpartum doulas? So a lot of the and I think Kylie might have answered this here. So there is a doula service that's in the community, doula service. Chicago Birthworks will be working with us. They already have doulas working in the field now, but we will be providing that more extensive training, specifically those things that we're hopeful that they can recognize and bring back to us. And they will be going through a formal training that we're providing for them. And this project will be going over for the next 5 years. So our hope is to be able to share our findings at the end of that.
this is just an incredible undertaking. I'm so impressed. I see a lot of comments saying the same thing. So I wanna emphasize that and make sure you hear that, Carrie, that this is super, it's so important. It's so important. And I mean, I think this could be truly groundbreaking to show some methods for improving outcomes.
And thank you all. It truly is. You know, when I first thought of the idea, it was just written on a piece of paper. And to have it come to this point, it's just like, oh, it could really make a difference. And so I'm hopeful, yes, I'm hopeful we can show that this can not only work in our community, but in other institutions in their communities to really see some change. It's necessary, it's important.
Cecilia, you have your hand raised.
So I think someone, even though you didn't get a chance to go to med school, you're making an impact. I am, right?
I'm sorry, I muted myself when I thought I'd unmuted myself. Carrie, we haven't had a chance to meet, but I've admired your work from afar for a long time, and I really want to congratulate you on this. And I'm sort of at the phase of my life where philanthropy is important to me. And as a 503c, and you've talked about that very briefly before you moved on to talk about the project, it might be helpful to some of us to hear how we could connect with the part of your work that is philanthropic, so that we can have that on our radar.
Absolutely. Yes, Melanated Midwives is a 501c3 that I am putting the website in there now. We will have an updated website coming out March 1st. So excuse our little mess if it's on there, but you can still donate through there. If individuals want to reach out for more of a corporate donation, please don't hesitate. We can provide a presentation on more specifics on what we provide the funds for. But yes, we are welcome to provide that information for you and are grateful for every financial support that's given to us for this effort.
So I do have a follow-up question that's about the research side. So can you talk to me about how people can end up in your study? I mean, are these clinic people come to your clinic and you invite them, or is there a network of people who are referring your patients to you for possible inclusion into the study?
So there's no referral. These are patients that are seeking care at the University of Chicago through their prenatal care. So they will call and schedule, or someone in the community will refer them, and then we will do recruitment on set days and have our research coordinator and our project manager, you know, ask them if they want to be a part of a study and go from there. I'm gonna grab my charger, 2 seconds. I just don't want to shut up. So a lot of the patients will be coming from, majority of them will probably live on the south side of Chicago. A lot of our patients live in the community there. But we do have some patients that come from west side, west suburbs, south side, Indiana. We have a lot of patients from Indiana as well.
To piggyback on that, are you also recruiting patients who want to conceive or wants to be, you know, want to get pregnant? Or just when they already are, like, then it's like they need prenatal?
When they have already scheduled for a new OB visit, we will be recruiting from those patients. There was a question, is prenatal and postpartum psychiatric care for the pregnant patient be a service? Absolutely. We are working with our social workers within the university, and we also have mental health services, a psychiatric department within our OB/GYN department. We have a specific psychiatric department that works with our pregnant patients. So they will be a part of providing referral services and care for our patients who desire that service.
I'm sorry if this was answered already or mentioned in your presentation, Carrie. I might not have caught it. Where are the participants delivering? Is home birth an option, or are participants all delivering in a healthcare setting of some sort?
They'll be delivering at the University of Chicago.
Okay.
That is the ideal. If patients are seeking birth center or home delivery, they would not fit the criteria.
Understood.
And that's partly because we can't follow them because they don't have their records with us. So we want to follow them and all the way through. So we want to really highlight the use of the hospital healthcare system because we're trying to change the environment and the way the hospital looks to the Black patient right now.
That makes sense. Thank you.
Of course. It would be interesting to ask the participants if they are multi-para about their experiences before from other hospitals compared to yours. It would be. We may have to add that. Any other questions? Thank you all so much. It's so good to see so many faces I haven't seen in so long. Thank you so much for the support. And you know, we're going to be here. We're going to do this and we're going to make some positive change. And I appreciate you guys supporting and sharing, and we'll see what happens. Thank you, Sarah, so much.
Thank you, everyone. And thank you, Carrie. This work is so incredibly important and very impressive work. Does anyone else have any other questions? Let me make sure we don't miss anything.
I just have a comment, and I wanted to say congratulations to Carrie, and know that you have a very proud UHP family, not only in the College of Nursing, but at the university at large. So continue the great work, and we support you.
Thank you so much, Sharice. I appreciate that. I worked with Sharice a long time ago when I was when I was a nurse, and she helped me through a lot of things tremendously. So I appreciate that. It's good to see you. All right.
Carrie, would you mind putting your email address in the chat? If
Sure.
people can email you if they have other questions.
Absolutely. I will put that here. And then there's also, if you send an email through Melanated Midwives, I'll get it too. So either of those are I can respond.
Great.
All right.
Thank you so much.
Thank you. I appreciate it.
Talking about your work.
All right. I'll give you guys updates soon.
Sounds great. Best of luck. Thanks.
All right. You're welcome.
Have a
Bye.
good day, everyone.